Diabetes remains a major public health concern in the Philippines. And in fact, an estimated 3 to 4 million Filipinos have diabetes. As we celebrate World Diabetes Day tomorrow, we take a look at the causes, symptoms, and treatments available for patients. To help us understand, we are joined this morning by Dr. Allan Dampil. He's an endocrinologist from St. Luke's Medical Center. Good morning, and thank you for being here, Dr. Allan.
Morning, Doc Fred.
Now, the studies show, or the statistics show, that the number of diabetes patients in the country continues to rise. Why is diabetes still so prevalent here in the Philippines?
Well, for one, Filipinos are, we think, genetically predisposed to diabetes, particularly type 2 diabetes. But for the most part, it's because of the change of the lifestyle among our people. We are moving less and eating more food that are predisposing us to diabetes.
So is it mainly just the food that are cause of for diabetes, or what are the causes of diabetes?
Well, it's a combination of many factors. As you can see now, there are proliferation of a lot of fast food, and with fast food, there's also proliferation of less activity. So people are moving less and eating more. On top of the genetic predisposition that we have, we are really seeing an increased proportion of people developing diabetes, particularly type 2 diabetes.
So it's so unfortunate. All the factors are present here in the Philippines for being predisposed for diabetes. Now, some of the signs and symptoms naman, Doc, of diabetes, how can one think that they have diabetes, or what are some of the signs and symptoms that raise a red flag?
Well, the problem really with diabetes is that many are asymptomatic, meaning they don't feel anything. By the time they feel symptoms, the sugar is really high. And the symptoms are polyuria, or the frequent urination, polyphagia, or patient often eat too much.
Or they're so hungry all the time?
Yeah, hungry all the time. They can lose weight or gain weight. And these are the common signs and symptoms. Some would be the latter part, which is blurring of vision, wounds that do not heal, itchiness, particularly in the private areas.
Now, is there a certain age group that is more prone to this type of diabetes?
Well, the older you get, the higher your risk to develop diabetes. But more and more we are seeing younger and younger patients developing diabetes.
How young? How young, doctor?
Before we rarely see type 2 patients for ages less than 30, but right now we're seeing 20s, even patients in their teens developing type 2 diabetes.
Wow, that's really definitely young. So let's talk about the types of diabetes really quick, Doc. First, there is the type 1 diabetes. Can you explain that?
Type 1 diabetes is the one wherein their pancreas no longer secretes insulin. Insulin is a hormone that allows the cell to get the sugar. Okay. These people don't have any capacity to produce insulin, hence the sugar goes up. But the most common type is type 2 diabetes, wherein they have a resistance to the insulin and a dysfunction in the pancreas as well. And another common type is gestational diabetes. It's getting more and more common as our Filipina are getting older when they get pregnant.
This happens during pregnancy.
Yeah, the demands of pregnancy for more insulin is not met by the capacity of the women who has this disease to bring down the sugar.
Okay, so for those women who are watching who might get pregnant or planning to get pregnant, what should they watch out for?
Well, it's already recommended, and their OB gynecologist will already test their sugar at around 23 to 24 weeks. So they will be screened regardless of...
Okay.
But if their doctors might screen them earlier if they have risk factors, such as they are a little overweight, or they have family history of diabetes, or they had gestational diabetes during prior pregnancies.
Okay, so as of this day, doctor, unfortunately, there's no cure yet for diabetes. Is that correct? No, but what are some of the medications or treatments available for those with diabetes?
For type 2 diabetes, the best treatment is still diet and exercise.
Or a lifestyle change, you know?
Yeah, lifestyle change. That is still the primary treatment, but of course that is the most difficult for most patients. But we have, the fortunate thing is that we have more and more medications
Right.
to address this issue. We have metformin, insulin, of course, and a myriad of other oral antidiabetics. For type 1, of course, there's only insulin as treatment.
Okay. Now, how can one prevent naman diabetes, doctor? Siyempre, it's the Christmas season is coming. A lot of food that you might mention might be on the plate of a lot of people. How can someone prevent themselves from falling to the trap of diabetes?
Well, the usual would still be proper diet and exercise. This means at least physical activity of 30 minutes every other day, and then eating the right food. Basically, what our grandmothers have taught us for years, it's still the same dictum.
Okay.
But the first thing about prevention is really knowing if you are at risk.
Okay. Thank you very much. Thank you for that, Dr. Allan Dampil.